Top 10 terrifying mistakes made during surgery. All of us wish to get the best care when we visit the hospital, and that's a fair demand. I mean, that's the right of a patient. Unfortunately, sometimes doctors do blunders and put the life of their patient at risk. Here are top 10 scary objects that were left inside the patients during surgery. Before we go on, don't forget to click like and subscribe for more content of amazing facts. Number 10. Making me squirm. A Philadelphian man had an open heart surgery and the physicians forgot the wire 2 feet long hanging outside of his chest. He never had any complaints and continued living perfectly normal until he went for a follow-up over a month later. Number 9. Pair of forceps. After a road accident, a man found out that he had been living with a pair of 15-centimeter forceps inside of him all this time. The surgeons concluded that the forceps were inside him for the past 18 years. He went to the hospital due to pain, but the doctor said he had an ulcer and kept him on medication. Well, the second road accident sounds like a blessing for him, otherwise God knows for how long he would have been living with the forceps. Number 8. The most terrifying. A woman had surgery for a cyst on her liver. She kept complaining about the pain for 3 years post-surgery but never visited the doctor. Eventually, she literally pooped out part of the surgical forceps, and this is actually scary. Number 7. Sponge. Now this one is the most common item surgeons often forget when they cut open a person for surgery. A man in California went through a fairly simple surgery but met a tragic ending. The surgeons left a sponge inside his body which caused an infection. The man was unlucky and lost his life due to cardiac arrest 10 years later. Number 6. Blunder during heart bypass surgery. A surgeon forgot a scalpel inside the patient undergoing a heart bypass surgery. The patient visited the hospital a few months later to ensure there was nothing wrong. The surgeon, being aware of the missing scalpel, conducted an x-ray of the patient, but there was nothing in the x-ray, as the scalpel moved to the abdominal cavity from his chest. The scariest part is doctors told the patient that it was very dangerous to move the scalpel from the current location, so the patient had no other option but to live with the scalpel. Number 5. A whole scalpel. A surgeon who operated on an army bed forgot a whole scalpel inside the patient. The patient lived with the scalpel for 4 years until one day he visited the hospital complaining of extreme dizziness and abdominal pain. The scalpel was lodged between the bladder and rectal area, which is very scary to imagine. Number 4. Retractor. Back in 2000, a man went to see the doctor complaining of severe pain after his cancer treatment. The physician wasn't concerned and prescribed him pain relievers. After a CAT scan at the airport, it was discovered that the man was living with a retractor inside his abdomen and chest, which was causing him to feel suffocated. Number 3. Mystery gauze. A man went through a pretty simple surgery, but it turned out to be a scary one. Instead of feeling better, this man felt worse after the surgery as he started feeling dizziness and fatigue throughout the day. When the nurse was checking his stitches, she noticed there was gauze sticking out of it. This gauze was the least of the concern. The much scarier news is there were 16 additional items found inside the body in further scans. Honestly, this was a huge mess up. 2 more surgeries were conducted to remove everything. Number 2. The gloves and compresses. A woman went through a surgery to stop her intense periods, and apparently it went smoothly, but she complained of intense pain. She went to the hospital, but the doctor sent her home, prescribing some painkillers. After a few days, the pain got intense with the contractions until she gave birth to a glove and 5 compresses which were left there during the surgery inside her body. Number 1. Epidural needles. Well, we all agree that pregnancy and childbirth are painful in itself, but this woman got unlucky enough to bear the pain for longer due to the negligence of the doctor. The epidural needle was stuck in her spine, which caused her pain for 14 years. She went in for an x-ray and discovered that the needle broke off and had remained in her back the entire time. Well, to be honest, I'm scared of surgeries now. Anyways guys, thank you so much for watching and staying tuned. Give this video a thumbs up and share if you ever had any such experience.